Hey everybody, welcome to Cancer Rehabilitation, what we believe is an emerging standard of care. And you're going to have a conversation with a couple experts, and it's a real pleasure to be with you. I'm Dr. Jay Harness. I'm a general surgeon with 36 plus years of experience in focusing on breast cancer. It's been my real honor and privilege to have been a past president of the American Society of Breast Surgeons, Breast Surgery International, and the American Association of Endocrine Surgeons. I'm currently the Chief Medical Officer for our Maple Tree Cancer Alliance, and it's my privilege to still be a clinical professor of surgery at the University of California, Irvine. One of the really fun things that I've been involved with for nearly 10 years now is a social media site called Breast Cancer Answers. I've been the medical director since we launched that site in 2011. What's unique about this social media site is that it's all video, and it's a site for breast cancer patients, their family members, and friends. Currently, we have a little over 1,300 videos at Breast Cancer Answers. We're privileged to have nearly 18,000 subscribers, and we're sort of blown away by the fact that we've just surpassed 12.5 million views of our videos. You can find us at breastcanceranswers.com or go to our YouTube channel, which is again under Breast Cancer Answers. My host for this evening is Dr. Leslie Waltke, who is not only a physical therapist, but has her doctorate in physical therapy. And Leslie is the founder of the Waltke Cancer Rehabilitation Academy. She has over 25 years of devotion to clinical oncology rehabilitation. She's an international speaker, an educator and consultant, and an award-winning author. She's the founder of The Recovery Room, an educational social media channel for over 7,000 cancer patients and survivors. Hey, Leslie, great to see you. You know what? You and I have been working on this for a few weeks, and we're really excited about doing this broadcast. Our target audience are going to be medical oncologists, surgical oncologists, radiation oncologists, physical therapists like yourself, exercise specialists. We're really hoping that administrators of cancer centers will be tuned in with us tonight. But what you and I both realize is we're talking about a really, really important subject, aren't we?
Yes, we are. It really is. You know, with the changes in oncology and the changes in demographics of our population, there's going to be more and more cancer volume, and it's really time to step up and take better care of these people. And the thing that we're going to talk a lot about in this series is minimizing preventable loss.
Yep. And I have to confess to you, as I already have, and to our audience, I'm a newbie to this area. I mean, even though I've been focused on breast cancer, surgery and multidisciplinary care for the past 36, plus years, when it comes to your world of cancer rehabilitation and the world of exercise oncology, I'm a real newbie. And one of the things that I'm most impressed with, not only am I impressed with you, but I'm really impressed with the people who've been working in this area, Leslie, for years.
Yeah.
I mean, the fact that we've got 1,000 clinical trials that have bona fide information, that have this information is accumulated over the last 10 years or more, and that frankly, what you do, it needs to become a standard of care even more than it is today. But I think the audience would really appreciate sort of your overview of this whole emerging area of exercise as a real standard of care.
Yeah, I'm happy to do that. Okay, the current demographics, Jay, are really driving so much in oncology care. So we know because of our increasing age of population and increasing size of population that we have more cancer cases. When you combine that along with our increasing 5-year survival rates that we're seeing, as well as our flat or declining death rates that we're seeing in cancer care, This is all leading to an increased number of people living with cancer or a history of cancer. I think as of January of 2019, we had just under 17 million cancer survivors in the United States, and that is supposed to hit 22 million people by 2030, I believe. So we have a growing number of people with cancer. So we have then more people living with the burden of fatigue, pain, weakness, and functional loss. So when we talk about minimizing preventable loss, it's really, really important for a couple of factors. Number one, these substantial impairments have huge impacts on healthcare quality of life. And they also impact mortality risk. And they also impact costs for both the patients and certainly the medical systems. So from our friends at ASCO, they published a big paper in 2016 on pain. And one of the quotes I pull from that paper is that chronic pain can be a serious negative consequence of surviving cancer. And one of my quotes then is, what good is it to cure somebody of cancer if we trash them in the process? So when we talk about quality cancer here, we want to talk about people that are either we've eliminated their disease or we've slowed the progress of their disease, but return people to their preoperative or pre-diagnosis comfort and functional levels as best possible. So both of those things are important for successful cancer care. And then they also stated in this paper that upwards of 40% of people in the United States with a history of cancer are still experiencing some level of pain. And that number is really, really high. And when you can take a physical therapist that can address much of that and reduce much of that with a very low risk, low cost treatment, it's something that we really need to be paying better attention to.
So all of these facts are really important. And you and I are in a growth industry. My goodness, the numbers you're sharing with us right now about and it's reality. I don't mean to make light of it, but it really is reality. We are in a growth industry, and the things we're going to be talking about in this presentation are really critically important.
And just to follow up with another point of yours, is we talked about how rehab and exercise can improve quality of life, but we'll talk more about the data in a bit about how it can also impact length of life.
Yep.
And it can also, there is evidence now that in colon and breast cancer survivors, exercise actually decreases risk of recurrence. So it's just such a powerful medicine and tool that, again, we need to get better at utilizing.
Yep.
So all of these demographics, increasing the burdens on survivors and the medical systems as things get more expensive. I think I just saw a stat that the national expenditure for cancer care in the US is $150 billion. So it's already a huge burden. Because we need more rehabilitation, we have to highlight the need for awareness on the medical side, and we need to promote referrals on the medical side. Because rehabilitation is a referred to source. So you can have the world's best physical therapist down the hallway, but if you don't send your patients to them, their patients aren't going to get help. So that's a real stickler. And again, we'll talk about that towards the end when we talk about the cancer rehab gap, I call. So we have a lot of work to do.
Very good. That's a beautiful overview of where we're at today. It's a wonderful overview. Thank you.